Here with Dr. Mark Gordon from the Millennium Warrior Angel Foundation. I didn't think we were ever going to get to this interview because we've just been laughing for an hour. I met Mark last year and I was very grateful to know him, and really pleased that you wanted to sit down and talk to me.
Well, thank you. I mean, what? I was going to say no to someone as lovely as you?
Yeah.
Come on.
Thanks.
Not just the accent. Great personality, yes.
So I want to start with some really simple things because Mark, gosh, I don't even know where to begin. Mark does everything, but in terms of regenerative medicine and really simple, easy things that people can do now to increase their health span.
Right. Well, for me, I do neuroendocrinology, which is about the hormones of the brain. And the hormones of the brain really regulate everything that our body can and does do, from regulation of insulin, of blood sugar use, our blood pressure, and so forth. So if you want to have a quality of life, really what you need to focus in on are the simple hormones that your doctor can assess and then determine whether or not you need any improvement in it. I always relate to the brain as being the central processing unit, like what you have on a computer, a CPU. It regulates everything in the body. And if that CPU is damaged or if that CPU is broken, what's going to happen to the rest of the body that it controls? It's going to break down. So people who have been wheelchair dependent because of head trauma or some kind of a trauma that diminishes their hormones, after getting their hormones replaced, what happens is they're able to get out of their wheelchair. And we have a number of patients who didn't have a stroke, but because of unknown reason, according to traditional conventional medicine, they were unable to walk. And it's always an awestruck kind of situation when you see them get out of the chair 3 months after they start their treatment therapy and start living life again.
And the treatment therapy is mainly hormonal based?
Correct. There's a panel that we do, which is looking at the key hormones that are produced both in the brain and also in the periphery of the body and glands, endocrine glands. And we can measure them, and those that are below the optimal levels, the healthy optimal levels for therapeutic benefits, we raise them up. One of the greatest battles that I have in conventional medicine is that the interpretation of the laboratory results, where they just want it within the range as opposed to being within the healthy center of the range. When you bring people to the center of the range, that's where they get the benefits, and that's what we're looking for.
I'm also of the mind too, I get really frustrated when somebody says, oh no, those levels are normal for a 70, 80-year-old man or whatever. It's like, well, that's cool, but what if I want them to be normal for a 40-year-old?
Right.
Make me normal like that again.
Absolutely. So back in, I started in this in 1997. So we started looking at exactly that. Where's the optimal level? And also, does age really matter? Well, no. Age doesn't matter, because if you look at when we're the healthiest, it's between 25 and 35 years of age, look at the hormone levels at that level, and then look at it at someone who's 70 years of age, who's having problems thinking, who's not able to hold their bladder, they're having problems walking, they can't do the activities of living. So they're just sitting there quietly waiting for their own demise. So by returning the hormones to a more healthy, optimal level, which is between 25 and 35 for us, you see an incredible improvement in their quality of life.
We've got to stop thinking that normal is dwindling down towards death.
Correct.
Yeah.
Correct. Well, there is really no normal range for hormones. There's, in traditional or conventional medicine, what they did was they took 1,000 people and they took their blood, pulled it together, they found the midpoint of that, and they said, okay, this is going to be the reference range. Well, that reference range only applies to the 1,000 people that were used for that study, but for you and I, we have our own reference range, and that reference range is not a number. We need to stop treating people based on the numbers. We need to treat based on how you're feeling. Well, I'm not sleeping well. We need to increase your melatonin or oxytocin or testosterone or whatever is responsible for helping us to have good sleep. It's not based on the numbers.
Now, when you think of hormone supplementation of it, probably the last thing that you think it's going to help is the brain. I don't know why. You sort of think, because hormones, you think it's for energy and...
That's right, but here's the question. Where does the energy come from? When you're in the gym and you're lifting weights, where does the energy come from? The determination that says, go over to that dumbbell and lift it up and curl it 50 times or 20 times. Where does that come from? It comes from the brain. We know that when we're testosterone deficient or hormone deficient, that our focus is off, that our aplomb, sense of well-being, our ability to complete tasks, our creativity are all diminished. And when you replenish the hormones, they come back.
That's so interesting, because in that scenario, I would have thought, because the body's ability to absorb oxygen diminishes with age, I thought that's where it comes from. But you're right, it's all.
We've had patients who had severe chronic anemia. They weren't bleeding. It was just a matter of their bone marrow not making the red blood cells, and therefore the hemoglobin that carries the oxygen. When we started them on, we tested them and found them to be hormone deficient, specifically testosterone, dihydrotestosterone, DHEA. When we replaced it or replenished their level and brought them up to a range that was between 25 and 35 years of age, what happened? First time in their life, at 43 years of age, first time in their life, they had normal levels of red blood cells and hemoglobin. Wow. That's because these things stimulate the bone marrow to produce red blood cells.
And so is there anything that somebody can do to keep their hormone levels as optimal as possible? Or is it a losing battle and we're just all going to have to need help?
What I've seen in the 34 years of practice that I've had, but more specifically 24 in endocrinology, is that there's a parallel between as the hormones drop and more problems in our body. So what are the problems that appear to diminish more rapidly our levels of hormones? The aging process, unfortunately, and that's because of the accumulation of free radicals or oxidative stress. And oxidative stress or free radicals are byproducts of metabolism. So if you're eating high carbohydrates or drinking a lot of alcohol, not doing any physical activity, these free radicals rise up in the blood and create damage. So a healthy lifestyle is key. So if you maintain a healthy lifestyle, that could benefit your levels of hormones. And then on top of that, if you've had any kind of injury, surgery, exposure to radiation, certain medications that influence your brain's ability to regulate hormones, you need to address replenishment to a more optimal level. But it's regular aging process and then traumas that have happened to you.
Are we screwing things up when we're still young and we still have optimum hormone levels and we take a contraceptive pill, or a young guy who's working out takes testosterone, or are we setting ourselves up for failure, or is that fine?
Having 3 daughters and having the 3 of them go through our program, birth control pills, aside from introducing what we call xeno hormones, these are hormones that are not produced in your body, they're from cow or synthetic. These have detrimental effects to the regulatory system in the body, for one. They also, when you put estrogen into the body says, hey, if you're putting estrogen into my body, I don't have to make testosterone, which becomes estrogen, so you lose things like DHEA, testosterone, dihydrotestosterone, and your natural production of estradiol and estrone and estriol. So it is damaging the system, but what I've monitored in my daughters is the fact that when they're off of it, there's a return to a more normal level. Not always 100%. I've had patients in the past that needed a little bit of a hormone added to it, whether or not it was progesterone or a little bit of testosterone. But optimally, you return to where you started.
Because those hormones that you're depleting by giving your body that message, like in a nutshell, I would call those your mojo.
Yeah, that is your mojo. Absolutely. Keep me going in the groove. So
do you think maybe women who've been taking that contraceptive pill for 50 years of their life, but then they're prescribed an antidepressant?
Yes. Well, what happens is, because of the feedback loop, which is when I take or when a woman takes a birth control pill, it tells the brain, stop making your own. And what you lose are things like testosterone, which have 90,000 articles relating it to depression, with estradiol, 103,000 articles talking about the relationship of low estradiol and depression. So we're in essence setting ourselves up down the road for developing these things like depression, mood swings, anxiety, bipolar, OCD. It's all part of it. Because we see it on the other end when they already come to us deficient with these, like from last year's presentation that I did, when they already come to you with the psychiatric labeling and we check their hormones, we see the hormones are down, we give them the hormone correction, and more times, 90% of the time, 91% of the time, they get better.
Yeah. So, and just so I'm not missing out on the blokes, if you're supplementing with testosterone.
Well, guys who are taking anabolic steroids, which is just high levels of the hormones that regulate our body, what can happen is if you don't go through what they call a recovery protocol using HCG or clomiphene, what will happen is you can permanently lose not only your own testosterone production, but your sperm production and become infertile. So if you guys out there are using anabolic steroids, make sure that you have some form of turning your body back on with HCG or clomiphene citrate. Otherwise, you run the risk of being infertile and never returning your natural production to normal.
And so there's been a lot of talk about hormone replacement and bioidentical hormones, and people talk about how great they feel.
Right.
And I'm like, well, I'm 41. Shall I start now?
Well, age has nothing to do with it. You go in and you test, and the results will help to diagnose whether or not you need it. So the perfect match is a patient who comes in and says, Doc, I'm not feeling as energetic, but you're 31, 41, 46, 23 is my youngest, and not feeling well. And what happens is that stimulates us to go and do the laboratory testing, and what comes back are deficiencies. And then you go into their history and say, did you ever have any head trauma? Did you ever do? And they said, yes. When I was a kid, I have 2 patients who were dropped from the 2nd floor balcony by accident and landed on the first balcony. And for their whole life, they've had emotional problems, psychological problems, and we saw their hormonal results. We corrected it. They're like living a new life.
Wow.
Yeah. So it's very important that the subjective, your complaints, are matched to the objective laboratory testing. And you need the combination of both to make a decision, whether to treat or not.
This is just, it's another enlightenment that if you're feeling like something's not quite right. And I know a lot of people, they don't speak up, or because they think, God, as soon as I go to the doctor, I'm just going to be put on antidepressants, and I don't want that, so they just suffer.
Correct. And that's because we see in our lay publications that people are committing suicide. Oh, they were on antidepressants, but that was the problem. They didn't need to be on antidepressants. They need to have their hormones checked to find out that they were hormonally deficient, which created the depression, and their doctor didn't look deep enough and just put, here, take this antidepressant. As you know, in the United States, we have to, as in other countries as well, but here specifically, because this is where I'm at, our physician desk reference has the names of every drug that's associated with increased depression or increased suicide ideation, and we give it like water. And we don't check for why they're having the deficiency or they're having the symptomatology, and we find it in our practice, which is purely about the hormones of the brain, and we find it in almost 100% of the patients, and therefore they get off their medication.
So in a blanket, because we can't obviously prescribe people, or and it's not legal for you to tell them to do things or not.
Correct.
I can. I'm not a doctor. They can't take away my PhD.
Right.
But would a really good rule of thumb be if your doctor says to you, take this, just always say why.
Right.
What else could it be? What else can we try?
Yeah,
I'm a why.
Correct. You need to be a why because we tend to exalt physicians, medical care providers, healthcare providers, and we put them on a pedestal, so we accept what they say at face value, when we should be more inquisitive and asking, okay, doc, I understand what you're saying. Can you send me to some literature to read? Or can you explain to me how that relates? If it sounds feasible, or if it doesn't sound feasible, you ask. And a lot of times I have patients coming in and saying that things that I'm doing are crazy. And so what I do is I usually ask for the email address of that doctor who said that, and I'll send them 3,000, 4,000, 5,000 articles to help them. It's Andrew, the other half of our Warrior Angel Foundation.
Oh, cool.
Yeah. So you can clip that. Anyway, so I have a library of responses to those physicians, healthcare providers, who think what we're doing or what I'm doing is totally out of concept of anything. And it turns out that they just haven't read the literature that's readily available. And that's my number one plight here in everything I do with this organization, with all the organizations, is about dissemination of information that has been available for 30 years that no one's reading. They don't have time to read it because
I was going to say, it's not like I'm a doctor hater or anything,
right.
but because they work so darn hard, like 70, 80-hour weeks, when do you have time to, there's so much information out there.
Right.
How do you assimilate all that?
Well, I'm fortunate. I practiced. I still practice 7 days a week. I had to practice 7 days a week in the past. Now it's my pleasure to practice that. Things have gotten to a level of stability. I have 3 daughters. 2 of them are docs, and they're helping out. And so I have more time to go and read the literature. And I thought, when I started in this arena back in 1997, but relative to the brain and hormones in 2004, I thought it was more important for me to have to gain knowledge than it was to gain dollars. So I sacrificed, I won't say sacrifice, I opted out of practicing 5 days a week to practicing only 3 days a week. So 2 days a week were spent, and the weekend was spent reading literature. So, people say, oh, you're the expert in the brain. I'm not an expert, I'm just well read in the area. And my goal is, I train docs 2-3 times a year in the hormonal venue relative to traumatic brain and brain health. And they take the information that I've condensed down in a nice book, and they
And the name of your book?
And the name of the book is called Traumatic Brain Injury, A Clinical Approach to Diagnosis and Treatment. It's a 321-page program text to help make it easy for physicians who are so inclined to read it, and it chapter page by page leads to the next step, so they slowly acclimate to the information based upon 1,600 articles that are embedded in that book to help you, so to substantiate everything I say. And everything I do say is backed by literature.
Yeah.
I'm not smart enough to come up with some of these concepts that these brilliant doctors that I'm reading have already come up with. There's no need to reinvent the wheel. There's just to apply it. And that's what we do, clinical application of interventional endocrinology.
And the name of your book for non-doctors? It's like to keep them away from Google? Because when you start on Google, by the time you've finished, you've got every problem under the sun.
Right now, the non-physician book is in the process of being written.
Oh, I can keep you posted.
Yeah, it's condensed from the physician form, and it's just the language is being changed, the number of pages being reduced by a third, and the focus is really from the consumer standpoint, from the patient standpoint, as opposed to a physician telling a physician or supporting a physician. My books are always written in the interactive state, so it's like 2 people sitting down, as we're doing right now, and sharing information and a lot of stories, a little anecdotal stories, but here's the support. Because I believe that when you are sharing scientific information, that if you deliver it on such a high level, people are going to ignore it.
That's why we're doing this.
Oh, is that why we're doing this?
That's why we're doing
thanks.
this.
Okay, fine. So it's really it's not about me showing how well I understand the verbiage, but it's about how well I can convey the information to people like yourselves who can apply it. Go to your doctors and ask them, hey, I want a complete hormonal panel done. I'm not feeling well here. I don't want to take any of the conventional medication. Check me out first thoroughly, and then tell me what's up. That's the key.
Yeah, and I think it's your right to request that.
Correct. Yeah, and one of the things I'm a little irate about is patient goes into their doctor's office and pays for services, pays for the laboratory work, but the doctor won't give them a copy of the lab results. I never, to this day, so when we treat patients, we not only give them a raw copy of their labs, but we give them a 60-page booklet interpreting all their stuff and giving them suggestions and giving them supportive documentation about what we're suggesting, and then a page on suggested therapeutic regimens. And 90% of what we use are all nutraceuticals, which are natural products. Good quality products, some life extension, some pure encapsulation, just some of the high quality products, and they work extremely well. It might not take a day to work, it might take 2 weeks to work, But the bottom line is it's not synthetic. It's not an artificial product that you're putting into your body to possibly become a toxin, but natural products that the body can work with, the bioidentical products.
Yes, yeah, because hormone therapy used to actually be, from what I hear, the most awful thing to have to go through, and so it got such a bad rep. So now that it is at the level that it should be, and helping people and changing their lives, I think a lot of people aren't even looking at it because of the bad reputation it had.
And that's because of our failure to really disseminate to the lay population this type of information. That's why I commend you on doing this, because the information can save lives.
Yeah.
As opposed to the traditional conventional medicine, which obviously takes life. And for instance, there's one suicide in the United States every 9.5 minutes. The majority of the people are on medication against depression, but it's the medication that's creating the problem. So how do you deal with that? Correct the real problem, hormonal.
Yeah. Yeah,
that's my
I totally agree.
Yeah.
And so ask, when you're in there, ask for your full hormonal panel and ask to get the results.
Right.
Ask why. And what I always, if someone says, it's X, Y, Z, and I go, well, what are the reasons that could be happening? And I usually just, if I get medication, I go home and it goes on the shelf until I know the reasons that it's happening.
And there are resources on the World Wide Web, like Google Scholar, that you can go in and find from reputable medical publishers articles on just about everything. So it's just free.
How are they written? Because
they're peer-reviewed articles.
But are they written in English or science? That's my question.
Well, it's a great question. And what I tell my patient population is to just read the abstract and the introduction and the conclusion. Don't read the gobbledygook in between.
Good advice.
So read the beginning and end, and it'll give you a concept of what it is, and then you can use Wikipedia to find out some of the things, or you can use Merriam-Webster dictionary to help you understanding the information. That's why I'm spending time on rewriting the traumatic brain injury book so that it's specifically written for the lay population. So a lot of all the gobbledygook hopefully is taken out. So it gives you an ABC kind of approach to what happens to the body when it's traumatized and what you can do to help it naturally.
So I read it and I feel smarter, not dumb for not being able to understand it.
Correct.
And that's
correct.
Yes,
it's not my
love
goal.
That you're going
my
there.
goal is to help people to adapt to the information by call it spoon feeding, or by making the language more common. Okay.
Yeah, I love that. I love what you're doing, and please, I can't even tell you everything that Mark's doing because we would be here forever. So Google Dr. Mark Gordon and the Millennium Warrior Angel Foundation, and you'll love him as much as I do. Thank you so much for your time.
It's been a pleasure. Thank you for
having me.